Oh, morning, Philip. Thank you. Come and take a seat. Oh, you're looking well. You've been on your travels again?
Yeah, I've been travelling around southern Africa for a couple of months. Vic Falls, whitewater rafting on the Zambezi, Namib Desert, lions in the camp, face to face with a great white shark, snakes bigger than me, the lot.
Sounds fantastic.
It were amazing. Glad to be home though. Got a bit full on sometimes.
Yeah, I think it's always good to get home, actually. Anyway, thanks for updating your medical history form. Let me just have a quick look. So, it's still just the asthma. 2 inhalers, salbutamol and becatide.
Yeah, if anything, my asthma were better when I were away. I got to the top of Mount Kilimanjaro. Not all of our group made it. Even so, I kept taking them as sometimes I got a bit tight in my chest. I know the asthma's still there.
So what sets your asthma off?
Only exercise these days, like being chased along the riverbank by a hippo.
I don't think that's going to be a problem in here. So anything new about your asthma since we last met?
No.
Okay, so just to recap then from your medical records. 4 attacks of asthma bad enough to get you into hospital, the last one being a year ago in Barcelona. Another was a few years before that, set off at the dentist, and then the first 2 when you were first diagnosed with asthma as a child.
That's it?
Okay. Any more steroid tablets for your asthma since Barcelona?
No need.
Anything else I need to know about your medical history?
No.
You've lost a little bit of filling on the lower molar tooth. Did you know that?
No.
Are you okay?
Chest feels a bit tight.
Okay. I'm just going to sit you up. That should help.
Just have a couple of puffs. That's better. Just felt a bit funny for a moment then. I'm fine. Let's carry on.
Well, it's worth just making a couple of checks first, okay? I'd like to check your pulse and your breathing rate, alright?
Alright.
We can get you a spacer, okay? That should help.
I'll get the bag. There's one in there.
Thanks, Gina.
Sorry about this. Messing you about.
It's not a problem. Your pulse and your breathing rate are slightly higher than normal. How are you feeling?
Okay. I think I will have another couple of puffs.
Okay. How's your breathing now?
Still a bit tight. It's not like me at all, this. The spray will soon kick in.
The spacer should help get the drug into your lungs. Here's Gina now. Gina, can you pass me the pulse oximeter, please? And also the manual. I just want to double check something. Thank you. Okay, Philip, just going to put this on your finger. Thanks.
Cat's standing by if we need her.
Good thinking. That's 96%, pulse 94, and that's on air, so we can hold off on the oxygen for now. Okay. Philip, just need to check your peak flow before you have any more salbutamol, okay? Thank you.
You look really flushed.
Embarrassed. Have you got a tissue? My nose is running.
Your pulse has gone up. It's over 100 now.
I've got a bad feeling about all this.
Is your skin itchy? You got a rash?
It's on his neck as well.
This isn't just asthma, this is an allergic reaction. Gina, get Kath now. Tell her to bring the phone, please. Okay, Philip, gonna get some oxygen onto you, okay? Full flow. Now we just get this over your face. There we go. Kath, call an ambulance, please. Got severe allergic reaction, cause unknown.
You know he got stung by a wasp in the patient's loo just before he came into the surgery.
What? You never mentioned that. Well, that'll be the trigger. Adrenaline. You need some adrenaline, Gina.
Okay, I'm getting it ready.
Okay, get adult dose, please.
Yep, I will pass. Okay, it's ready.
Okay. Give it outer thigh. Philip, sharp scratch coming on your leg.
Oh.
Time?
10:46. Oh, probe, is the probe off?
The ambulance is coming, I'm staying on the line.
Okay, Gina, get another adult adrenaline pen ready, please. I'm going to need it soon. Kath, we need to raise Philip's legs up. We could use something.
What about his bag?
Ah, good idea. Okay. 1, 2, 3. There we go.
The rash is getting worse.
Can't feel a pulse. Breathing's about 30 a minute. I'm going to give him some more adrenaline.
It's by the bag.
Philip, another sharp scratch coming on your leg. This will help you, okay? You're doing really well. Any news on that ambulance, Kath?
It's very close now.
Can you go to the main door and wait for it there, please? Well, that's the notes written up. You know, I have never been so scared. He got bad so quickly. I felt helpless.
Me too. You came across really calm.
No, I wasn't. I was way too slow to realise it was anaphylaxis. Too focused in on asthma. Asthma was the obvious diagnosis.
I think you're being too hard on yourself. I saw him rubbing his eyes and scratching his stomach and I didn't make the connection.
I didn't notice those things until late on. Got on with the ABCs. D was fine at that stage. I forgot about E until I finally saw him scratch himself. The rash on his skin was so obvious where he hadn't got much of a tan.
Well, the paramedics said we did really well. They liked that we made a list saying what happened and when.
You know, that was straight out of the training. I thought it was good when we had it. There were lots of things that stuck.
You never think it's going to happen to you when you're training.
Too true.
It's just a wasp sting.
Yeah, people die from anaphylaxis. We did well, Gina.